Right. Good afternoon, everyone. It's been a true pleasure to welcome you here today to the 2022 annual general meeting for the BC Health Coalition. My name is Tuesday Andrich. I am the current Labour Chair on the BCHC Steering Committee and a representative from QB, British Columbia. I'd like to open with a traditional land acknowledgement. The BC Health Coalition acknowledges we are based on the unceded and traditional territories of the Coast Salish nations of Musqueam, Tsleil-Waututh, and Squamish nations. We acknowledge the many territories and lands across Turtle Island that you are all joining us from. We're honored to be here as guests on this land that Indigenous peoples have cared for and continue to care for time immemorial. We invite you to take a moment to think about where you presently live and to honor the people of the land. Think about your relation to the place you live, work, and interact. This is our inquiry to honor the past and present and to stay connected to decolonization practices. We invite you to use the chat to share the name of the territory or land from where you're connecting from as part of this acknowledgement. And we'll just give people a minute to do that as they are able to. And while folks are doing that, for myself, I would like to acknowledge that I'm an uninvited settler residing here on the unceded, stolen, and occupied lands of the Musqueam, Tsleil-Waututh, and Squamish nations. And I would further like to express my support for the full implementation of the 94 calls to action by the Truth and Reconciliation Commission. And in this space particularly, I'd like to highlight calls 18 through 24, which are the health calls to action. So we have a couple housekeeping items too, just to let you all know this meeting is being recorded. All registered participants will receive a link to the recording after the meeting. As well, please mute your microphones when you're not speaking. And I would like to now hand it over to Adrian to take us through the agenda and minutes, please.
Hi, my name is Adrian. I am here as a representative from Community Action Initiative. We're a member of the current steering committee. I'm also joined by my colleague, Emily Wagner, who will just take this piece here.
Thanks, Adrian. We're pleased to join you from the Community Action Initiative. We are members of the steering committee. And I'll just take a moment to acknowledge that Community Action Initiative operates from the stolen and occupied territories of the Musqueam, Squamish, and Tsleil-Waututh nations, and also serves communities across BC, represent over 200 First Nations. So I believe I am going to call this meeting to order. We can start with agenda overview. Does anyone have any feedback for the agenda? I'm hearing none. So I'd like to call for a motion to approve the current agenda.
Diane Wood, motion to approve.
Do we have a second? Is it Phoebe? Yeah. Or does Phoebe have? Okay. Thanks. Moving on to our 2021 AGM minutes approval. Does anyone have any feedback for the minutes? The minutes were circulated as part of your meeting package. Again, hearing none, I'd like to call for a motion to approve the 2021 AGM minutes. Linda, do we have a second? Phoebe and or Sarah. Phoebe. And I think with that, thank you so much, everyone. I will be turning it back over to Tuesday.
Sorry, folks, did I unmute myself? Can you hear me? Great.
Yes, yes.
Fantastic. Sorry, my computer went a bit crazy for a second there. Okay, as mentioned earlier, thank you for bearing with me. As I mentioned earlier, I'm the Labor Chair on the Steering Committee, and I'm a representative of QP British Columbia. I myself am also a healthcare worker. For the past 13 years, I've been working in Vancouver's downtown east side in many different capacities, supporting people who live with concurrent physical and mental health challenges, and also by advocating for improved supports and dignity for them. I came into this role in early 2022, as so many of us activists too, by being voluntold by a mentor of mine to step up and get involved. And I'm honestly so happy I've been here and had the opportunity to be involved, as it's been a really incredible year of work with a team of really wonderful individuals. From my fellow hardworking steering committee members, current and departing, to the dedicated staff at the BC Health Coalition and our many enthusiastic members and supporters across British Columbia, I want to extend my heartfelt thanks to you all for everything that you have done throughout the year to implement as well as support the important work that the BC Health Coalition has accomplished in 2022. And what a year 2022 has been for us. You know, we won at the BC Court of Appeal against Cambie Surgical Clinic and Dr. Brian Day, which was the latest development of the BCHC's over a decade-long fight against the legal attack on BC's universal public healthcare system. We held Minister Dix to account for his mandate on long-term care with our Seniors Accountability Assembly, as well as sent more than 1,000 postcards to government to demand better care for seniors in BC, with an end to for-profit long-term care and an increased investment in home support services. Along with the Canadian Centre for Policy Alternatives, we jointly published a report on the concerning rise of corporate medicine in BC, which revealed the troubling reliance the province has on outsourcing healthcare to for-profit clinics. By standing in solidarity with Migrant Students United, we supported grassroots demands for health coverage for all migrants in BC and celebrated the community victory of the announcement by the Ministry of Health that individuals with maintained status will have access to health care while their application to Immigration, Refugees, and Citizenship Canada is being reviewed. And in partnership with the Canadian Drug Policy Coalition, we held an educational event on British Columbia's changing drug laws, where we learned from and discussed with people with lived experience of drug use the role safe supply and decriminalization plays in combating the toxic drug supply in BC. And we reaffirmed the coalition's solidarity with people who use drugs by supporting evidence-based policy and care. And while that isn't an exhaustive list of all that we have accomplished in 2022, it's an overview that I hope drives home the reality that together we have made much progress this year in strengthening British Columbia's healthcare system, as well as made important strides to improved access and dignity for all persons in the province. And while we have much left yet to do, let's take a moment to celebrate our successes. And with that, we have a little year in review video that we'll be starting right now. So let's take a moment to watch that too.
At the BC Health Coalition, our role is to bring together a broad cross-section of civil society to fight for public solutions to healthcare issues. We have a strong history of defending our public healthcare laws in court, advancing public solutions around wait times and primary care reform, and fighting for improvements in seniors' care.
The march was organized by the Asiatic Exclusion League, and unfortunately there were members of organized labor who were taking part in this. And so as labor activists, we kind of have a historic mandate to end the drug war, because we did sadly play a small part in its beginning.
You have to look at recruitment and retention of healthcare workers, increasing training spaces, and I think also considering how healthcare is delivered in the community is really important.
There's increases in the use of for-profit clinics, and so you have public funds going into the pockets of private investors.
Human rights approach also means that we move away from corporations extracting profits from seniors' care. It's old austerity-driven thinking that tells us that we can only afford to take care of people if we incentivize the private sector to do it for us.
Sheila Moyer, and I'm here on behalf of the BC Federation of Labor, and we represent over 500,000 members of our affiliated unions.
My name is Scott DeLong. I'm here on behalf of the BC General Employees Union, and we represent about 85,000 members.
My question is, Minister Dix. Minister Dix, my question to you is.
So my question to you, Minister Dix, is.
Minister Dix, I end my story by asking you this question.
Public health advocates say the growth in private surgical clinics does hurt the system in the long run.
Because you're actually moving those resources, namely people, specialized healthcare professionals from public hospitals, because you're trying to outcompete and pay them for shifts in for-profit clinics.
We are all extremely thrilled that the appeal was dismissed. I think this is a real win for public health care.
On Friday, the British Columbia Court of Appeal unanimously upheld a lower court's dismissal of Day's challenge of the Medicare Protection Act, saying bans on extra billings and private insurance do not violate the Canadian Charter of Rights and Freedom.
Great, thank you so much for jumping in, Mazdak. And with that, I would like to pass it on to Usman to present the 2021 financial statements.
Thanks, Tuesday. Hi, folks. My name is Usman. I'm the coordinator of the BC Health Coalition. I'm here on the unceded territories of the Coast Salish people, the Musqueam, Tsleil-Waututh, and Squamish. This report, end of year financial for 2021, was sent out as part of the meeting material to all of you. So you should all have a copy. But what I'll do is I'll share my screen, and I'll just do a quick sort of overview of where we ended last year's budget. And I'm happy to entertain any questions or comments you may have. And so hopefully folks can see my screen here, but I'll start with where we ended our 2021 year, which is at a pretty comfortable deficit of $300. I mean, we pretty much broke even, but I'll point your eyes towards line 19, which is deferred revenues general project, which shows that we actually deferred around $67,000 in revenue from 2021 to 2022. So that actually means we had quite a bit of surplus for 2021. And we've taken that surplus and deferred the revenue to this year. So one of the things we'll have to do at the end of this current financial year is take a look at where we are, whether we're running a surplus or deficit for this year, and what we're going to do with the deferred revenue from last year. In the past, we've put some of that revenue towards our equity. In particular, I'll point you to line 25, total retained earnings. And so that figure there, $62,000, represents basically what the BC Health Coalition has in the bank for a rainy day. That's our about 25% of our operating expenses, and it's a backup. So, you know, depending on where we are at the end of this year, we may decide we want to beef that up a little bit, or we may choose to defer that revenue in another way. I'll also point your eyes towards line 20, which is deferred revenues for our legal defense project. So like Tuesday mentioned, we won a victory again in the Canby case. And that's something that Health Coalition has been fundraising for and you know, fighting in the legal courts around for the past decade. And so we have a legal defense fund separate from our operating expenses and operating account. And so at the end of 2021, we ended with around $230,000 in our legal defense account, which is a pretty good sum to end our year, our 2021 year with. We know that we're potentially looking at heading to the Supreme Court of Canada in the case. And we have, you know, our legal counsel has projected costs of around $300,000 for that stage of the case. So again, we're in a comfortable spot, but for sure we will need some extra funds as we continue on with the Canby case. Around revenues, I'll actually pause my share here, and I will share part of our annual report. So this annual report was sent out as part of your package as well, and you'll see that part of the report has a breakdown of our operating revenue and operating expenses. And so again, this is just a bird's eye view, but the majority of our revenue comes from individual and organizational membership. So really, membership and the funds we receive from membership are sort of the lifeblood financially for our coalition. And then the next big chunk is, of course, the membership fees we receive from the steering committee membership. As far as our operating expenses, our staffing expenses continue to be the majority of our expenses for the coalition. And I do want to note that there was a slight bump in both campaign and operating expenses last year due to some non-recurring costs that were part of our strategic planning. But for 2022, we're likely going to see a similar sort of breakdown where staffing expenses continue to be the majority of our expense costs for the coalition. So I'll stop there, and if folks have questions or comments, I'm happy to answer those. So I'm not seeing any or hearing any questions or comments. So Tuesday, I will pass it back to you for approval of the 2021 end of year financials.
Sounds great. Thank you so much. So I'd like to call for a motion to approve the 2021 financials, please.
Approved, Diane Wood.
So it looks like We have,
Seconded, Barb.
okay, thank you, everyone. And I'll just get everyone to vote to approve those. Could you please raise your little hand? It'll be in your more section on the 3 dots. And you can click under reactions if you don't know where it is. Just giving enough time for everyone to do so. Okay, hands down, please. Just giving everyone enough time to please put your hands down. Couple of holdouts. One more holdout. Thank you so much. Okay, and now raise hands if you oppose. All right, seeing none, it looks like the financials have passed. Thank you so much, everyone. And all right, so we have, as we've mentioned before, we've engaged in internal education work in 2020 with our members in partnership with the Canadian Drug Policy Coalition. And as part of the drug policy dialogue that we have taken, we are launching a drug policy report. And with that, I'd like to pass it over to Mazdak to let us know about this report.
Hi, folks. Good to see you all here. Bear with me as I screen share really quick here. And there we go. Okay. So my name is Mazdak Arif Navaz. I'm the organizer at the BC Health Coalition, and I'm joining you from the unceded and stolen territories of the Musqueam, Squamish, and Tsleil-Waututh peoples here in Vancouver. So the BC government declared opioid-related deaths a public health emergency on April 14th, 2016, but has failed to respond proportionately and effectively. Every day, 6 British Columbians die as a result of the poisoned illicit drug supply. Every community in BC is impacted by the crisis, with a disproportionate impact on Indigenous and racialized people, people living in poverty, and people struggling with chronic pain and mental health issues. While this province has been going through multiple public health crises simultaneously, not all crises get equal acknowledgement. In fact, we acknowledge that the BC Health Coalition has been missing from advocacy in this area or from supporting the advocacy work of organizations that have long been advocating through the drug toxicity crisis. That's why at the strategic review process at the beginning of 2022, the steering committee identified that a priority for the coalition's work would be to do internal education with our coalition members to allow the BCHC to take positions on evidence-based progressive drug policy. A 9-month collaborative process was undertaken with our allies at the Canadian Drug Policy Coalition on this work, as they have decades of evidence-based research on drug policy. This process involved working with our coalition organizational members to organize a full-day drug policy dialogue educational event for their members, with the goal of learning from drug policy advocates, engaging in group discussions on topics of drug policy reform, and developing ideas, policies, and objectives that BCHC could adopt and mobilize to enact as first steps. On October 3rd, this work culminated in the attendance of nearly 50 members of the BC Health Coalition, including 9 steering committee members. The participants included provincial and local leadership from labor unions, organizers from locals, member activists, community and nonprofit leadership, frontline workers, and people who use drugs. At the event, participants affirmed BCHC's full solidarity with people who use drugs and advocated for evidence-based progressive drug policy in their group discussions. So today we're launching Beyond Prohibition, a summary report of the dialogue that took place between these participants. Included in each section is a set of recommendations for principles derived from these group conversations, as well as a set of corresponding evidence-based policies from the extensive work of our allies at the CDPC. Our hope is that non-coalition allies and coalition members alike can use these principles and policies to guide their future advocacy on addressing the drug toxicity crisis. The participants conveyed that the public view on drug use and drug policy has largely been shaped by narratives of stereotypes and stigma that has had profound negative impacts on people who use drugs, including coercing them into abstinence-based treatment models. Unregulated for-profit treatment centers were identified as particularly problematic, and it was determined that treatment must be premised on the principles of non-coercion, bodily autonomy, and prior informed consent. Participants expressed that a harm reduction framework is a better alternative to criminalized and medicalized models because it addresses the social determinants of health for people who use drugs. So with that, we've derived these principles. 1, equity, anti-racism, and anti-colonialism acknowledge and account for the disproportionate and distinct harms experienced by Black, Indigenous, and people of color in Canada with respect to health outcomes, drug policy enforcement, and related sanctions. For-profit treatment centers must be regulated and accountable to the provincial government to prevent the creeping privatization of the public healthcare system and to ensure treatments are informed by current evidence for best practice delivery models. Treatment must be premised on the principles of non-coercion, bodily autonomy, and prior informed consent, be completely voluntary, and incorporate culturally appropriate programs and service delivery models. And finally, harm reduction is a user-developed and led philosophy of non-judgment and care. Its implementation through specific programs demonstrably improves public health and safety, reduces public costs, and leads to improved mental and physical health outcomes for people who use drugs. It should be integrated into a full continuum of health and social services, including housing and safe supply. And the harm reduction policies are increased investment into voluntary, non-coercive, and culturally appropriate harm reduction services, including a full continuum of health and social services that promote the safety and well-being of communities. Increase emotional and material supports for people who use drugs that have been released from prison or are incarcerated due to conviction for drug-related offenses. Center the voices of people who use drugs and affected communities from diverse backgrounds in the entire legislative reform process, including planning, drafting legislation, implementation, and evaluation. Participants also conveyed that criminalization puts marginalized communities at a disadvantage and that there are a variety of limitations to the current BC decriminalization pilot. They identified that it is problematic for the police and other law enforcement to be referring people who use drugs to health and social services, and that there should be an increase of resources for community-led programs and services that promote health and human rights. So with that, our principle, police and other law enforcement must be removed as gatekeepers or liaisons between people who use drugs and health and social services. Any referrals should be non-coercive and culturally appropriate, and referrals should be made by organizations led by people who use drugs and skilled, trained frontline workers. The decriminalization policies are fully decriminalize all drug possession for personal use and necessity trafficking by a full repeal of Section 4 and amendments to Section 5 of the Controlled Drugs and Substances Act. Implement automatic expungement of previous convictions for simple drug possession, including for cannabis, and an applications-based expungement process for necessity trafficking, as well as expungement of previous convictions for breaches of police undertaking, bail, probation, or parole conditions associated with charges of these acts. Develop clear rules and strict limitations as to when police can stop, search, or investigate an individual for activities that are criminalized under the CDSA. Participants discussed issues specific to workplaces, workplace policies for people who use drugs, and all workers. They identified it was problematic that workers who use drugs face stigma and discrimination in their workplaces, as they are often offered only two paths under current collective agreements: take a medical leave or face disciplinary processes. Participants discussed several cases of punitive measures and employer-mandated treatment regimens that are harmful to workers, and that labor unions must support workers more through changes to collective agreement language and lobbying for governmental policy changes. From those, we get the principles: employers must be accountable for properly resourcing harm reduction-based treatments, including but not limited to safe supply, and other non-coercive approaches that are culturally appropriate to workers who use drugs. Harm reduction services must have the robust and emergency level resources to ensure the safety of all frontline workers, including proper staffing levels, training, and mental health supports. And finally, labor unions must support workers who use drugs through changes to collective agreement language that is more binding, includes a modern, informed decision-making process, and provides for evidence-based alternatives to the medical or disciplinary approaches. And finally, participants identified that unregulated drug supply leads to the contamination of drugs and unknown potency, and thus overdoses, expressing that mitigating this through legally regulated access to pharmaceutical grade drugs is a public health and social justice issue. They discussed various gaps and barriers to safe supply that exist, and that access to safe supply must be expanded through alternatives beyond the medical model. Participants also acknowledged that legal regulation of drugs is a broad term that denotes a wide range of potential regulatory models, which should be developed collaboratively with people who use drugs through community-driven solutions to prevent reproducing the inequalities embedded in medicalized and for-profit models. And lastly, our principles: legally regulated access to pharmaceutical grade drugs is a public health and social justice issue that would mitigate many drug policy related harms, including fatal overdose. Access to safe supply must be expanded beyond the medical model to include alternatives such as user-led compassion clubs and distribution sites. Government funding to drug user and community groups must be increased in order for them to effectively and sustainably implement these services. Finally, legal regulation encompasses a wide range of regulatory models. Frameworks, models, and policies for legal regulation should be developed collaboratively with people who use drugs through community-driven solutions to prevent reproducing the inequalities embedded in medicalized and for-profit models. The safe supply policies, finally, is develop, implement, and evaluate a comprehensive emergency response strategy to scale up access to safer alternatives to the toxic illegal drug market, safe supply, in partnership with people who use drugs and the organizations that represent them. Implement a single regulatory framework, legal regulation for all psychoactive substances, including alcohol, tobacco, cannabis, and other substances. This framework should aim to minimize the scale of the illegal market, bring stability and predictability to regulated markets for substances, and provide access to safer substances for those at risk of injury or death from toxic illegal substances. So finally, where do we go from here? As one participant stated, in the now, we have to be willing to take these conversations back to our workplace and to start informing our members and employers about this. The principles and policies born out of these conversations serve as a pathway to mobilize and engage our membership in this public healthcare crisis that sits at the intersection of so much of BCHC's work. And I'm happy to say that there's momentum behind this issue. Just last week at the BC Federation of Labor Convention, the vast majority of delegates approved multiple resolutions calling for expanding safe supply, extending the BC decriminalization pilot, pardoning prior convictions, advocating for harm reduction instead of the abstinence model, and implementing an oversight system to make sure drug use treatment is culturally safe, accessible, informed by scientific evidence, and remains voluntary. So with that, I will take the time to wrap it up and say, please check out the full report on our blog post, bchealthcoalition.ca/drug-policy. We'll also put the link in the chat in a minute. And of course, if you have any questions about the report itself, or if you're excited about this work and would like to get involved, please absolutely send us an email at our general inbox, or you can email me personally as well, and we can have a conversation as well. So with that, I will stop sharing and throw it back to Tuesday.
Thank you so much for the report. That's awesome, Maz. I did see there is one question in the chat. So it's from Ryan Hill. With Ryan's permission, hopefully that's all right since it's out there. I will read it out to everyone. What about referrals in the context of protection cases, i.e. someone's substance use puts a vulnerable individual at risk? Would BCHC still support such referrals being non-coercive?
I don't know that I can go that deep specific into answering questions at this time. But what I would encourage folks to do is read the specific section of the report, and also the fact that this is ongoing work that we're doing, and so when it comes to the policies and the principles sort of laid out, the work is ongoing, and we're continuing that, and they're sort of umbrellas, but they're not kind of prescriptive to every scenario.
Thank you so much. I see I have Diane Wood's hand is raised. Diane, please.
Thank you very much, Chair. I just had one comment in the report, and I think it's an important area, particularly relating to the issue of workers. And I know there's been a lot of work done in negotiations on the issue of employee assistance programs between unions and employers. And there are many programs in existence in collective agreements. And this is a very, very important area that unions have negotiated, and where we can work with our members when there are these very important issues that arise. So I don't know how we can deal with that as incorporating it or recognizing it, but I know probably Sheila for sure has a lot more information on that. And of course, lots of resolutions at the Federation of Labor Convention over the years. But it is a very important area for inclusion in collective agreements that does exist, and really good work being done by employee assistance committees. Thank you very much.
Thanks, Diane. I see Colleen Fuller's hand is raised.
Hi, and thanks for the report. It was excellent. I guess one question I have is what is going to happen down the road a bit. Is there going to be, for example, a working group established to sort of pilot some of the work? And also, if there has been any discussion about working with the community health center sector on this, because I don't know what's going on around the province, and maybe Valerie would be able to comment on it. But I know at Reach that this is a big issue. It affects a lot of our community in East Vancouver, and it is the public policy arena just hasn't been very supportive of some of the work that we know needs to be done. So anyway, I'm just wondering if there's a relationship with that sector, if that's on the horizon, and also whether there will be a working group dedicated to this.
Thank you so much, Colleen. Those are excellent questions, and I can say that what we do know for sure, our relationship with CDPC, the Canadian Drug Policy Coalition, is ongoing and continuing. This was not like a one and done sort of deal, and our the points you raise are very important, I think, specifically in the context of strategic planning that is coming up at the BC Health Coalition in the next year, where we can integrate kind of all of these conversations into furthering all of the important work that we want to do, including on this issue. So what I can tell you for certain is that our relationship with CDPC is continuing, and we know that we want to do more on this. What that looks like, I think, will be determined in the next few months over the strategic planning processes with our new steering committee. But I'm certainly very excited about this work, and I see from the responses many people are as well. So I'm very hopeful.
That's great. Thank you so much for all the questions. I'll just give a few more seconds. If anyone has anything last minute, raise your hand. You can also put it in the chat if that's more comfortable for you. Just give it a couple minutes here. Okay, so seeing none, thank you so much for that report and for the discussion. That was really great. And I would just also at this point to take a little minute to recognize and acknowledge the contributions of our departing steering committee members that we had in 2022. There's a few of them. One is Adrian Bale from Diversity, Melinda Marquis from CAI, Tanya Patterson from CUPE, and Edith McHattie from HSA. Those are all of our steering committee members who have departed in 2022. They have all done great work. We're really going to miss them a lot. So let's just take a moment to recognize all the things that they have contributed. And with that, we are slightly ahead of schedule. So we're going to take about a 15-minute break here. Oh, sorry. Oh, no, they're just hands. They're hands clapping. Sorry, I thought they were hands raised. So we're just going to take about a 15-minute break here because this is the end of our open session. And then I want to thank you guys so much for joining us. That's really awesome. We really appreciate you being here and being so engaged. And then we also have our second half of the AGM coming up at 2 p.m., which is only open to members who represent current organizational members of the BCHC. So thank you again, everybody, for being here with us.